Democratic Senator Jean Shaheen has been negotiating on the sidelines with the GOP, and she joins us now. Senator, thanks so much for joining the program this morning.
Nice to be with you.
You are known to be a moderate. You work on the other side of the aisle. You even voted for the break the filibuster back in March. Why have you decided not to support this bill right now?
Well, I think this is an opportunity for us to talk to each other. I think we can address both keeping the government open and the health care needs of so many of our people. There's urgency about this because we know that if we don't address the premium tax credits, the subsidies that so many people have been getting to help afford health insurance, that they're going to see their rates double by November. And health insurance companies right now this month are setting those rates. So we need to get together. We need to address this. This is an issue that affects both Democrats and Republicans. You know, over 70% of people who are getting those health insurance subsidies are in states that President Trump won. 56% of them are in Republican districts. I talked to my colleagues on the other side of the aisle, and they say, we agree, this is a problem. So let's sit down, let's fix it, let's come up with a time frame to do that.
So, Senator, part of the sticking point is that Section 2141 part of the bill, and that's the funding that a lot of Republicans are pointing to, that when you look at it, it can go to illegals in emergency hospitals and things like that. But Democrats are saying that's not true. But when you actually dive in the numbers there, that is a sticking point, and it is true, right?
Well, we know that Medicare, Medicaid, and the Affordable Care Act health insurance market all prohibit anybody who's illegal from getting access to health care. So if there are places, what you're referring to is a provision that was put in place back when Ronald Reagan was president that said hospitals and emergency rooms had to treat people who showed up and needed care. So the idea that this is an effort to make sure that illegal immigrants can get health care is just not true.
But
and
Senator,
I think all of us want to see any fraud and abuse that's part of the program addressed. You know, I was a governor. I worked very hard to make sure we got the best we could from every single tax dollar. And that's what I think most of us want at the federal level as well.
But Senator, to that point, and you know this, and I don't want, you're right that that rule exists, and it was passed by Ronald Reagan. But during the big, beautiful bill, there was debate on this, and there were some modifications to that to remove, when it comes to some of those loopholes, they call it the California loophole, when it comes to some of the undocumented immigrants, the illegal immigrants, and some of the people that aren't Americans just yet, that may be going through the asylum process. They took that out during the big, beautiful bill. And it looks like Democrats are trying to stick that portion back in. So, you know, we can go back and forth on the small little details, but in fact, people that aren't in the country legal.
Well, that's not a small little detail. I would disagree with you. I think that big, beautiful bill was passed with totally Republican votes. I'm not interested in seeing that we provide health care for illegal immigrants. What I am interested in seeing is that people who are going to get pushed out of their health insurance because we're not willing to extend those tax credits are really going to be hurt, and that's going to affect the whole health care system. So I think we can agree we all want to deal with waste and fraud. We all want to make sure that it's American citizens and legal Americans who are getting access to health care. The illegal immigrant is just a red herring that's designed to try and prevent people from talking about the real issue, which is how do we provide health insurance for people in this country?
You know, I say a little detail, you say a red herring, but the fact is, Senator, that
no, I'm agreeing with you. Listen, I'm agreeing with you. You're trying to make an issue where there isn't one.
No,
we agree.
Senator,
illegal immigrants should not be getting access to the Affordable Care Act marketplace.
100%, Senator. But what I'm saying is that members of your party are making this an issue.
Well, I can't speak for members of my party, and I don't think you're right. I think you're making it an issue. Vice President Vance is making it an issue, but I haven't heard anybody in my party saying that illegal immigrants should get access to the health insurance marketplace.
I'm so glad you said that. Actually, I have some tape of your Democratic Party members saying this on the debate stage. So they've all said it. Let's play the clip.
A lot of you have been talking tonight about these government health care plans that you've proposed in one form or another. This is a show of hands question, and hold them up for a moment so people can see. Raise your hand if your government plan would provide coverage for undocumented immigrants.
Senator, that's literally every member of your party, from moderate to more progressive, that have said that in the past. I'm seeing them all on the cable.
I beg to disagree with you. I have not said that in the past. In New Hampshire, we do not provide health insurance for illegal immigrants. We have never done that, and you're just wrong. So the question right now is, what are we going to do to ensure that we're not kicking 24 million Americans, raising their premiums for health insurance, doubling those, and kicking 4 million Americans off of their health insurance? And that's the urgent issue that we need to address. And people on both sides of the aisle are talking about, how do we work together to address that? That's what I think we need to do.
The Washington Post says that they feel like the Democrats are falling into the president's trap. And this is going to give him the opportunity to cut other programs that he wanted to do during DOGE. So do you feel like you're falling into a trap laid by the president?
Well, I think the president has been cutting programs and federal employees since he took office, from day one. So this is nothing new. The urgent issue for us now, and we need to come together on this, and I would hope that the president would work with congressional leadership to bring people together. That's when I was governor. When we had an issue that we disagreed on, I went to my Republican legislature and I said, let's sit down, let's figure out how we can address this so that you're comfortable and so that the citizens of New Hampshire are benefiting. That's what we need to be doing now. I think there are people on both sides of the aisle that want to do that, and I would hope the president wants to do that, because as his own pollster said, if the GOP lets these health insurance subsidies expire and premiums double for people across this country, the GOP is going to pay at the voting box next November. So it's in everybody's interest to get this done.
Senator, I appreciate you coming on the program, because I think it's essential.
Good morning.
This debate that's happening in the country right now, I think all of us want the government to reopen, and I appreciate you
Absolutely.
giving our audience some time this morning. I hope you'll come back. Thank you.
Thank you.